Namaste. Myself, Dr. Dinesh Agarwal, consultant, medicine specialist and diabetologist. Diabetes, we all know it is a rampant and India is the diabetes capital of the world. And more than 3 million people are affected by the eye complication due to diabetes, which we are unaware of. Why this happens? When your blood sugar is uncontrolled, this affects the tiny blood vessels which are there in the eyes. This is known as diabetes retinopathy. Around 12.5% of the people having diabetes are affected by diabetes retinopathy. And out of this 12.5%, around 4% of the subjects are having immediately threat of losing their vision. Now let's talk about the major warning signals of the eye damage or eye complications. There may be a blurring of vision, there may be dark spot or floating in front of your eyes, or there may be difficulty in vision during night hours. Whenever you get any of these symptoms, please consult your doctor and visit to an eye specialist immediately. As you know, a timely intervention, we can prevent the eye damage, and the eye complications are preventable by controlling our blood sugar properly. To prevent any complications, we should do self-monitoring of glucose. Now let's discuss how self-monitoring of the plasma glucose helps in preventing diabetes retinopathy or eye complication. By seeing the spike patterns and lows and highs in their pattern by the self-monitoring of glucose gives our patient that which food, which activity or which stressors is going to change their blood sugar level, and they become more aware, they become more proactive. Timely detections of changes in the blood sugars helps your medical team to adjust your medication or intervene aggressively to prevent various complications, like in this case diabetes retinopathy. Timely intervention by knowing the self-monitoring of the blood values allows us, the medical team, to intervene at right time to prevent or before the irreversible damage sets in. The glycemic variability and the chronic hyperglycemia remains the key driver of diabetes retinopathy. It has been seen that by reducing the glycemic variability and the chronic hyperglycemia, we can prevent the progression of diabetic retinopathy or development of diabetic retinopathy both in type 1 as well as in type 2 diabetes mellitus. Here is my advice to you. We should develop a habit of regularly checking our glucose, and as recommended that at least 150 minutes of exercise per week, 5 days in a week should be done. It's my advice to you. You should do your eye checkup regularly, even your vision is normal. We recommend at least once in a year or as and when required seems. And I will recommend 3M. You should remember 3M: monitor, measure and manage.